Hi, I'm Tamara with Vannon Healthcare Services. I have been in the medical field for over 20 years, from practice administrator to medical billing, and today we're going to be talking about telemedicine. A lot of practices wonder, why should we do telemedicine? And that was prior to the COVID pandemic. But now with the COVID pandemic, telemedicine would be very beneficial to your practice. Some of the benefits of telemedicine would be patients would have better access to you. Also, you would be able to reach more patients, especially if they live in a very rural area. Also, telemedicine improves the quality of care that you could give your patients. You're able to give them a little bit more of one-on-one time, and the patient would feel more relaxed in their home setting. Also, with telemedicine, it reduces the overall healthcare cost. If your patient has requested for you to do a second opinion, you would have easier access to the documents because they can be sent to you electronically. With telemedicine, your patient's canceling or no-showing for the appointment will decrease. There are a few disadvantages with telemedicine. One is electronic glitches. Maybe your internet is a little slow, or the patient's internet is a little slow. From a personal experience with the electronic glitches is we had a video conference scheduled for my husband, and unfortunately the provider's video was not working, so we had to turn it into a phone consultation. So that's one way of getting around some of the electronic glitches. A lot of physicians are resistant to telemedicine. They don't know where to start. They don't have the proper software. But throughout our videos, we will give you tips on how to set your practice up. Another disadvantage of telemedicine is improper assessment of the patient. If the patient doesn't give you all of the information that's needed, maybe they didn't go get their lab work or a procedure that you ordered, then it's going to be hard to do a proper assessment. A lot of physicians think telemedicine will not work with their specialty, but whether you are a radiologist, a general practitioner, an ophthalmologist or neurologist, whatever your specialty is, telemedicine will work for you. With telemedicine, you can treat a wide variety of conditions such as asthma, conjunctivitis, rashes, insect bites, and many others. There are different types of telemedicine consultation. You can do the video chat platform. You can just do a standard phone consultation with your patient. You can also do remote patient monitoring as well. You're probably wondering how telemedicine and the insurance works. With the COVID-19 pandemic, a lot of the insurances are moving towards accepting telemedicine as a procedure, such as Medicare, Medicaid, and the private payers. Just be sure to check with the payers in your area that they do accept telemedicine billing. You're probably also wondering how HIPAA and telemedicine come into play. There are various platforms you can use that are HIPAA compliant. You can use Skype for Business, Microsoft Teams, or Zoom for healthcare. There are also others out there, but those are definitely HIPAA compliant. There are different apps you can use to communicate with your patient that are HIPAA compliant, such as Teledoc, Doc app. Commercial payers also have apps you could use to communicate with your patients, so please check with them.